Bismillahirrahmanirrahim. Today I am going to discuss physiology of treatment in shock, replacement therapy, blood and plasma transfusion. If a patient is in shock caused by hemorrhage, the best possible therapy is usually transfusion of whole blood. If the shock is caused by plasma loss, the best therapy is administration of plasma. When dehydration is the cause, administration of an appropriate electrolyte solution can correct the shock. Whole blood is not always available, such as under battlefield condition. Plasma can usually substitute adequately for whole blood because it increases the blood volume and restore normal hemodynamics. Plasma cannot restore a normal hematocrit, but the human blood can usually stand a decrease in hematocrit to about half of normal before serious consequences result. If cardiac output is adequate, sometimes plasma is not unavailable. In these instances, various plasma substitutes have been developed that perform almost exactly the same hemodynamic function as plasma. One of this is Dextran solution. Dextran is a large polysaccharide polymer of glucose. Certain bacteria secrete dextran as a byproduct of their growth, and commercial dextran can be manufactured using a bacterial culture procedure. Dextran of appropriate molecular size do not pass through the capillary pores, therefore can replace plasma protein as colloidal osmotic agent. A sympathetomimetic drug is a drug that mimics sympathetic stimulation. These drugs include norepinephrine and epinephrine. In two types of shock, sympathetomimetic drugs have proved to be especially beneficial. The first of these is neurogenic shock. Administering a sympathetomimetic drug takes the place of diminished systemic action and can often restore full circulatory function. The second type of shock in which sympathetomimetic drugs are valuable is anaphylactic shock, in which excess histamine play a prominent role. Sympathetomimetic drugs have a vasoconstrictor effect that opposes the vasodilation effect of histamine. Sympathetomimetic drugs have not proved to be very valuable in hemorrhagic shock. The reason is that in this type of shock, the sympathetic nervous system is almost always maximally activated by the circulatory reflexes already. So much norepinephrine and epinephrine are already circulating in the blood that sympathetomimetic drugs have essentially no additional beneficial effect. Treatment by the head down position. When the pressure falls too low in most types of shock, especially in hemorrhagic and neurogenic shock, placing the patient with the head at least 12 inches lower than the feet helps tremendously in promoting venous return, thereby also increase cardiac output. This head down position is the first essential step in treatment of many types of shock. Oxygen therapy. Major effects of shock is too little delivery of oxygen to tissue. Giving the patient oxygen to breathe can be a benefit in many instances. However, this frequently is far less beneficial than one might expect, because the problem in most type of shock is not inadequate oxygenation of the blood but the lung oxygenation of the blood by the lungs, but inadequate transport of the blood after it is oxygenated. Treatment with glucocorticoids. Adrenal cortex hormone that control glucose metabolism. Glucocorticoids are frequently given to patients in severe shock for several reasons. First reason is increased increase the strength of the heart in the late stage of shock. Glucocorticoids stabilize lysosome in tissue cell and thereby prevent release of lysosome enzyme into the cytoplasm of the cell, thus prevent deterioration from this source. Glucocorticoid might aid in metabolism of glucose by the severely damaged cell. Circulatory arrest. A condition closely allied to circulatory shock is circulatory arrest, in which all blood flow stops. This occurs frequently on the surgical operating table as a result of cardiac arrest or ventricular fibrillation. Ventricular fibrillation can usually be stopped by strong electroshock of the heart. Cardiac arrest often results from too little oxygen in the anesthesia, anesthetic gases mixture, or from depressant effect of the anesthesia itself. A normal cardiac rhythm can usually be restored by removing the anesthetic and immediately applying cardiopulmonary resuscitation procedure, while at the same time supplying the patient lung with adequate quantity of ventilatory oxygen. As usual, MCQs, please pause the video, read the stem. If for question 2 you have select the option B, it is the correct answer. Question 1, you select the option A, it is the correct answer. Now question 4, the correct option is A, and for question 3 the correct option is C. Thank you. Don't forget subscription and comments.